So hello and welcome to this interview event as part of the World Federation of Public Health Associations Global Public Health Week. My name is John Gannon. I'm a public health doctor from Ireland and the chair of the World Federation's Tobacco Control Working Group. Today I'm joined by one of our fantastic members, Dr. Michelle Jongenelis. She is the Associate Professor in the Melbourne School of Psychological Sciences with expertise in health promotion, intervention research, and behavioral and clinical psychology. Michelle's experience spans multiple health-related behaviours, including tobacco, and has worked with a broad range of organisations and sits on the Australian Council of Smoking and Health. Today, we're going to discuss a topic very close to Michelle's heart that she's worked on substantially over the last number of years, and that is the area of e-cigarettes or vapes. Michelle, thank you very much for joining us.
Thanks so much for having me.
So my first question for you is, vapes were initially promoted to the public and governments as harm reduction products, which could help people to stop smoking and overall be a positive influence on health. But very quickly, their popularity exploded among young people in particular and in non-smokers. And we started seeing huge numbers of addiction, and we saw serious lung illnesses and deaths happen. So I have two parts to this question. Number one, could you please let me know or tell us what is the best evidence available for vapes as a smoking cessation tool? And number two, what is the evidence for their harms to health?
Yeah, so I'll answer the second question first around the harms to health. So certainly one of the best and most comprehensive analyses that I've seen, most recently has been the work of Emily Banks at the Australian National University. So she published quite a comprehensive review outlining all the health benefits and also health risks associated with e-cigarettes. So the general conclusion of that review was that for smokers, the use of e-cigarettes can be beneficial only if they're using e-cigarettes to quit smoking, and if they quit smoking quickly, promptly, rapidly, and also that they then quit using vape products rapidly. For non-smokers, for those who have never smoked, for kids, there is no benefit to using e-cigarettes, but there are multiple harms. So that's the evidence around the harms at a broader scale. When it comes to smoking cessation, that same review found that there's limited evidence that these products have benefit, but there's also other evidence out there. So limited evidence doesn't mean there's no evidence. There's some evidence out there that shows these products can be helpful for smoking cessation. It's just not conclusive yet. I think that's sort of where we're at the moment. So there's certainly been some Cochrane reviews that have found that these products might be helpful. Certainly some of the work that we're seeing suggests that they're about the same as more, traditional nicotine replacement therapies when it comes to quitting. I think the important thing to realize, though, is in any study that's found that e-cigarettes are helpful for smoking cessation, they've always been used in conjunction with behavioural support. So if we look at the randomised control trials, it's always been e-cigarettes plus behavioural support compared to, let's say, nicotine replacement therapy plus behavioural support or behavioural support on its own. So using these products without any kind of support, there doesn't seem to be any evidence to suggest that that helps with smoking cessation. Okay,
thank you. You're based in Melbourne, and Australia has really taken a firm stance, particularly the last couple of years, on vaping. I saw, for example, legislation for prescription-only access, and also there's been a recent ban on importing disposable vapes. So it's been impressive stuff, and I suppose Australia's kind of taken a leadership stance on a global scale. Could you summarize for us, for kind of a global audience here, what the process has been like in Australia regarding vape policy, and what do you kind of expect to see or hope to see in the next few years?
Yeah, I mean, it's been a very long and exhausting process. Certainly, we've seen the industry interfere quite significantly in the process. They're still doing it now. We have legislation going to Parliament tomorrow, and over the last couple of weeks, we have seen industry increasingly renew their efforts to try and mislead the public and also policymakers. I guess I'll pick up on a word that you used, which is you used the word ban, and I think it's important to sort of point out that there isn't a ban. So we sort of talk about banning the importation of disposable cigarette products, e-cigarette products, which came into effect on the 1st of January. But we sort of often miss the end, or the industry will often miss the end, which is that these products can still be imported by those people who are using the product for a pharmacy. So a pharmacy can import those products. So they're banned from, or they're prohibited for recreational use, not for therapeutic use. And like I said, that process has been very difficult, and the industry, is still today talking about this is a ban, this is a ban. It's more about making sure that these products are accessible to those people who might benefit from it, which are smokers looking to quit smoking. But that doesn't mean we have to make these products widely accessible and available in convenience stores, which is, what you're probably seeing over where you are in the UK, widely available on the street. Anyone can access them. So there's sort of an interesting, it's a very nuanced word. And I myself have found myself slipping up and talking about bans. But, in Australia, certainly it's more around making sure that these products aren't as accessible to children. So on the 1st of January, we had the prohibition on the importation of single-use vapes. So that's a flat out ban. But then what we're looking at now is prohibiting all vapes unless they are being used through the prescription model that we've implemented here in Australia.
Great. I mean, like you said, here we have in Dublin, where I am, just vape shops all over the place. So
yeah,
certainly got a lot of work to do in curtailing their availability. And what you guys have done so far has been impressive. In your research capacity, Michelle, you and your colleagues have carried out a lot of surveys, interviews, focus groups, really looking at the public opinion towards vapes, and a lot of what you seem to have researched is potential regulations and restrictions that could be introduced and what the general consensus is towards those. Could you tell us some of the key findings or take-home points that your research has identified over the last few years? And are there observed differences between age groups in what you found?
Yeah, so we've, not just myself, but there's also been other organisations that have done this work. There is broad support. The vast majority of Australians support tougher restrictions on e-cigarettes. We ran a study at the beginning of last year where we didn't ask about support, but we asked whether people would think these new laws or laws in general would be effective, or what sort of laws they believed would be effective. And they did note that they believed the prescription model had the potential to reduce uptake, especially among youth, but that the model had to be enforced. There's no point having a model out there or a law out there if it's not enforced. And that's why we've sort of been seeing a lot of issues since the prescription model came into effect, is that there has been very little enforcement of this. So we often get people saying, these products need to be regulated. They're not regulated at all. Why can't we regulate it like alcohol, tobacco? What we often have to tell people is these products are very regulated in Australia. It's the enforcement of the regulation that is lacking. And the reason for that is that Australia had a very, not weird, we just used whatever was at our disposal. We had an imbalance, or nicotine products were treated separately to non-nicotine products. So nicotine products are illegal outside of the prescription model, but non-nicotine products are readily available, and anyone can get them, unless, of course, you're under 18. So because of that, you walk down the street, you walk into a vape store, you don't know by looking at a product whether it has nicotine in it or not. And we know that they're often mislabeled, and the vast majority of products that say they don't contain nicotine actually do contain nicotine. So let's say a law enforcement officer goes into one of these stores and sees that they're selling e-liquid. For them to be able to get them for something, they have to take that product back to the lab, they have to test it for nicotine, and then they can go back to the store and say, you've done something wrong or whatever. Now, that process takes too long. And by that point in time, the store has likely hidden or discarded any of their other product. So what these new laws are attempting to do in Australia is essentially apply the same law to both nicotine and non-nicotine product. And what that'll do is it'll make enforcement a lot easier, because it's not, there's no longer any need to go into a store and test a product, because if a store that's not a pharmacy is selling this product, they're just doing something illegal, regardless of what the contents of that product is. So what we found actually in our research is that people are saying, people are saying we don't see the point in non-nicotine products. Why do non-nicotine products exist anyway? They don't seem to have any benefit, and actually people might get the idea that these products are safer than the nicotine ones. So let's do away with the non-nicotine stuff. And there doesn't seem to be much of a difference either between, not so much age groups. You know, we sort of expect very similar things, you know, by age in terms of regulations, although we do find that younger people who are using recreationally tend to oppose stricter regulation because they're unlikely to be able to get a prescription when the prescription model came in. But there also doesn't seem to be much difference between those who vape and those who don't vape. So when we ask them, what do you think needs to happen to reduce vaping in Australia, almost all of them said to us, you need to get rid of the disposable products. You need to restrict the flavorings that these products are available in. You need to get rid of the brightly coloured packaging. You need to make these products more expensive, and you need to reduce their accessibility. So we had a broad range of ideas that these adolescents, young adults and adults came up with, some, you know, spanning completely banning them to, you know, allow them, but only through specific outlets. So I think we've certainly noticed a shift in public sentiment over the last couple of years. So I think it was around 2018, 2019 when disposable products hit the Australian market, and we noticed that significant increase in use in youth. I've definitely noticed a shift with, you know, parents, teachers, you know, just the general community going, you know, what is it with these vapes? Can we please get rid of these products? Whereas before, I think people sort of didn't really know what they were, because there were very few children using them until sort of 2019.
Fascinating that that the kind of vape and non-vape or non-users and users are sort of singing on the same hymn sheet in terms of desire to reduce their availability. And you kind of touched on some of the areas that have been highlighted, like reducing flavorings and availability and bright color packaging. And it kind of brings me on to my next question, because all of these things have already been done for cigarettes. And we look back to kind of the middle of the last century when there was advertising everywhere and doctors prescribed cigarettes to people. And it took so long to slowly grind down that availability. And a lot of that progress was delayed by big tobacco and industry kind of conspiring against public health policy and all that. So I suppose my question here is that in all the huge experience that all the success we've had over maybe 60, 70 years in making cigarettes more expensive, less appealing, harder to advertise, harder to access, denormalizing their use, can we apply those learnings to achieve the same results in a much shorter time span against kind of the vape industry?
Yes, I think we can. I think we don't have to. So we don't have to, and this is the approach that Australia is taking, is we don't have to wait the however many decades we waited with tobacco control to implement these measures. We don't have to wait 20 years to say, well, let's restrict the flavorings or, you know, the packaging. What we can do now is make it so these products just aren't available to children to begin with. So that's the mistake. That's the biggest mistake we've made. We made with tobacco is we made it a consumer good. We allowed it to be made a consumer good. And that's because we didn't have the evidence back then that these products were harmful. And that's a historical mistake. If we had our time again, I'm sure most people would never have allowed cigarettes to be sold as a consumer product and everywhere in the street. We have that opportunity now with e-cigarettes to do the same thing. We have that opportunity to learn from our past mistake of making cigarettes a legal, or sorry, consumer good. We have the opportunity now to never let that happen with e-cigarettes, so that we're not having to come up with laws around restricting flavorings and all this sort of stuff, because that stuff would just never happen anyway. Now, unfortunately, you know, the industry being the industry allowed that stuff to happen, and now we're having to play catch up. But certainly I think, you know, we can take all the learnings from tobacco control and we can apply them now, but I'd much rather, you know, take the biggest learning, which is not to allow these products to be consumer goods to begin with.
Awesome. Yeah, thank you. I have one last question for you, Michelle, and that is the World Health Organization's Department of Health Promotion has a no tobacco unit. There doesn't seem to be any specific e-cigarette or vape unit from what I could see. If you were invited to lead such a new unit, focusing on e-cigarettes from a global perspective, what would be the priority areas that you'd focus on to reduce prevalence and health harms from vaping in a global context?
I mean, if we go back to the World Health Organization's best buys, which, you know, apply to a lot of harmful products, you know, it all comes down to, you know, reducing availability and accessibility, increasing the cost of these products, and reducing advertising. So for me personally, I would probably, one of the first things I would do would be to look at reducing availability. That's not just in Australia, but in sort of countries around the world where they're seeing, you know, as you pointed out, every second store on the high street has these products on there that they're selling. So I would reduce availability as a first point. And then, of course, we've got the product things around the flavorings and reducing the appeal through the flavorings, prohibiting advertising. It's a lot trickier these days to prohibit advertising, because advertising doesn't just happen on your TV anymore like it used to. We've got digital platforms. We've got social influencers selling these products. So it is a little bit tricky, but, you know, if someone said, you know, you've got one day to do whatever you want, reducing the availability of these products would be number one. If you had asked me 10 years ago, I would have said ban these products altogether. Unfortunately, I think we can't do that at this stage, because there are so many people who are now addicted to this product that we actually need to wean them off them and introduce some vaping cessation supports for them. And there is, like I said, evidence there that suggests that they might help with smoking cessation. So we don't want to ban them entirely, but certainly reduce their availability would be the first thing I'd do.
Awesome. Thank you so much, Michelle. Really interesting to talk to you today. So as part of this, we have two interviews. We have this one here, and we also have another interview about tobacco endgame strategies with my colleague, Dr. Ellen Cosgrave, who is also a member of our tobacco control working group. So if you found this interview interesting, I'd really appreciate if you share it around with others. And I'm also going to have a link to a survey to complete. We're currently doing research with the tobacco control group into the opinions of young people, 15 to 30-year-olds, about vapes and also about tobacco endgame strategies. So the questions in that survey should take about 5 or 10 minutes to complete, and will be relevant to the topics that were discussed here with Michelle this morning. Thank you so much for your time, Michelle.
Thank you.
Really nice to talk to you today.